Hello, hi, I'm Paul. I'm a teacher at SET English. I'm an OET expert, and today what I'd like to talk about is an aspect of speaking that I think is very neglected by test takers and probably by trainers, because you don't see a lot about this in terms of OET materials that you find on places like YouTube or on Facebook. So I'm hoping that today I'm going to teach you something really interesting and very, very useful that will make you a little bit different to the person who takes the test before you and after you on the day that you take your test. So if you're out there and you're watching today, please let us know. Put your name, tell us where you're from. I'll shout out to you. It'd be nice to hear from you. Hopefully I can get a bit of input from you guys as well. So let me just check that first. Who have we got? We've got no comments yet. That's fine, no problem. Let's just switch to the study document and I'll tell you what it is that I want to do. Okay? So I want to talk about this. I want to talk about UIPP, and that's understanding and incorporating patient perspective. So we're going to talk about a little conversation. I'm going to try and make a dialogue. But before we do that, let's just focus on these indicators. Okay, so every criterion in OET speaking has got a number of indicators. Now, for understanding and incorporating patient perspective, which is here, okay, we have three different criteria. Okay, these are the criteria that we've got, the indicators for them. So eliciting and exploring a patient's ideas, concerns, and expectations, picking up cues, okay, and then this one here, which I think is really neglected, okay, relating explanations to elicited ideas, concerns, and expectations. I think we often don't do this. Sometimes we're given some advice in the cue card to do this, but sometimes we don't. So I'm looking at, can I do this in a way which makes me stand out from other people taking the test? How can I show that I'm a really, really good user of understanding and incorporating the patient's perspective? Okay, so the way that we'll go through this, and I'll sort of exemplify it, is that we'll go through a dialogue. That's the plan. Okay, I want to go through a dialogue. All right, so let's start here. And we'll start with the beginning of a conversation. And here what's happening is that the nurse is showing why we're meeting today. Okay, that's the idea. We're showing why we're meeting today. So if we think about the kind of reaction that the patient might have here, think about what's possible. Think about how the patient might react to this. Now I'm thinking here, injections. Patients don't like injections. Patients don't like needles. So let's think about how the patient could respond. They might say something like this. Injections. Okay. Injections. All right. So now we've got an opportunity as healthcare professionals to pick up a cue. Think about how you would respond if you heard the patient say injections. Okay. Well, I think what I would do if this was me, I would say, you seem a little concerned about having injections. Is that correct? All right. Okay. Now the patient is going to say, well, yes, I am concerned about it. All right. So this is nice. This is a good, typical kind of conversation. Okay. Very, very good. You've got to the point here where you have just picked up a cue. Okay. That's what you've done. Picked up cue. which is great. That's what we want you to do. You've picked up a cue. So now the examiner is going to say this person has done a good job. They've picked up a cue. There is B2. Okay, there's B2. We've picked up the patient's cue. Okay, next. We need to explore it. Okay, that's understandable. Can you tell me a little bit more? A little bit more about your concerns. Okay, that's nice. That's great. We're happy with this as well. Now we've got, not only have we picked up the cues, but now we have also elicited. Okay, so we've now elicited. So we've elicited patient concerns. That's great. We've done a really good job. Now think about what the patient's going to say. The patient's going to say something like, well, I had an injection last year and it was very painful. It also left a bruise on my arm. Okay, no problem. This is a typical conversation, a typical consultation and interaction between a nurse and a patient. So think about where we've come. We've ended up being able to say, okay, we've done B1, we've done B2. But now I need to relate my explanations to elicited ideas, concerns, and expectations. Now, in the case note, it might say something like reassure the patient and tell them something, but it might not give you everything. Okay, now I'm thinking that yes, there's going to be some reassurance now. Okay, you're going to provide reassurance, and then the rest of the conversation, there might be a description of the process. There might be advice. There might be obviously some checking and chunking, all of those things. But what I'm thinking you could do towards the end of this conversation, which is something that people don't often do, okay? What they might do, which is really, really good, is do this. So, earlier, you mentioned that you were worried about the pain or about bruising. All right, so it's possible that at this point, you said, okay, look, it's normal to be worried about that. You're going to show a bit of empathy, okay? You're going to show a bit of reassurance. You're going to show a little bit of empathy. And then you're going to say, but I can assure you this is a typical process. And you might not want to talk about the fact that there was some bruising, okay? So earlier you mentioned that you were worried about bruising on your arm. As described, the insulin injections will not be on your arm. They will be on your stomach, and they won't, and they are very short, and they are very short needles. They will not bruise you. How does that sound? Okay, so that's really nice. Okay, so now we've done the third thing in the in the understanding and incorporating patient perspectives. We're relating our explanations to things that we've elicited. So you're going to give a bit of reassurance. You're going to give a bit of empathy. You're going to describe the process and give advice about the process, and then you're going to reference earlier on that they mentioned a problem. Now think about this. The bruising on the arm was something that you elicited earlier on. So now what you're doing is you're referring back Okay, you're referring back to elicited patient concerns. So we've done B2, we've done B1, and we've done B3. And I think that these things, they're not difficult to do. It's about remembering to do them. That's what's important. And by getting feedback with a premium provider, this is where you can get good reminders to do this. You can talk about your techniques. You can talk about your 3-minute prep time. You can practice set pieces just like this, where you can go in with a teacher and you could say, okay, I want to do something more about understanding and incorporating patient perspective. And it can be a little bit difficult doing that with colleagues sometimes, or with friends. I really think that this is the kind of thing that you can do which can take your score and definitely get you over that line that you need to get over. Okay, so that was just a little idea that you might want to work on, something that you think is useful. And it doesn't just apply to nurses, even though this was a nurse's example today. Of course, it applies to everybody. Every healthcare professional is judged by the same criteria. So it's a good idea for everybody to try and practice this. Okay, now if you do want to practice this with a premium provider like SET English, come and find us. Okay, we're SET English. You can find us easily by following us on Facebook. You can follow us on YouTube as well. Come and find us and you'll be able to do lots of different things. You can do intensive courses. You can come and just do some speaking practice where you can practice things like this today. You can do mock tests. You can do letter reviews. We'll do all of these things with you. Every service that you need in order to get ready and be prepared and confident for the OET exam. Okay, so please let us know if we can help you. Get in touch with us if you've got any questions, and I'll see you soon. Take care. Bye-bye, everyone.